Good afternoon, and thank you for joining us today. Welcome to Smith, Gambrell, and Russell's live webinar called Healthcare Implications of the Tax Reform Bill. Today's webinar will be a shorter update and will last approximately 45 minutes. If you would like a PDF copy of this webinar, please email us at sgrcommunications@sgrlaw.com. Laura Andrew will be presenting today's webinar. Ms. Andrew is a partner in the Executive Compensation and Employee Benefits practice and the head of SGR's healthcare practice. Ms. Andrew concentrates her practice in healthcare reform legislation, compliance with HIPAA, federal and state healthcare anti-fraud laws, such as anti-kickback statute and Stark law. She also advises nursing homes, assisted living facilities, medical device, and life science organizations regarding compliance with state and federal regulatory requirements. Laura will be reviewing some of the frequently asked questions about the new tax bill as it relates to healthcare. All right, Laura, now I'm going to turn it over to you to begin the presentation.
Good morning, everyone. It's nice to have you all join me for this short update. This is our first experiment of doing a shorter update. And when you give feedback about the webinar, I would appreciate knowing whether you like these shorter presentations as in just a quick update on what's going on. So today we're going to be talking about the healthcare implications of the tax reform bill. So I'm going to go do an overview of what those healthcare provisions are. And then because I know many of you also wear multiple hats in your organizations, I'm going to talk to you briefly about other provisions that impact employers and employees, and give you an update on the new association health plan proposed regulations, which is what we talked about this in December or November of last year. I'm also going to mention the healthcare changes that were put in the continuing appropriations bill, which, as you may remember, those are the bills that keep the government running. And then I'm just going to give you some final thoughts. So first, as you know, Donald Trump signed the Tax Cuts and Job Acts on December 22nd, and this tax reform legislation will impact organizations working with healthcare, including employers and their employees. So while there are lots of provisions in this tax cut bill, I'm only going to really talk about the healthcare and the ones that are related to other employee-centric provisions. So first, we're going to talk about the individual mandate. And in the Tax Cuts Act, the individual mandate was eliminated by reducing the tax penalty to zero beginning in 2019. So the important thing to remember and to remind your employees is that the penalty still applies for 17 and 18. So it still applies for this year, and you still have to do the reporting requirements related to the individual mandate as an employer. So although there is no penalty applicable, large employers still have to offer plans or face penalties, and all other reporting requirements still are required, even though there is no longer an issue. Now, someone has mentioned that they need me to speak a little louder, so I'm going to talk up, and if this is too loud for someone else, please let me know. So going on, per the Congressional Budget Office, or CBO, the analysis, the repeal of the mandate will increase the number of uninsured Americans by 4 million in 2019, growing to 13 million. And just as a breakdown, there'll be 5 million people who just basically decide they don't want to get coverage anymore, 5 million people who don't enroll, and then 3 million who will choose to no longer have employer-sponsored coverage. So that's one of the important things for employers, is that you may have some employees, additional employees that choose not to have your coverage now. So they also estimate, CBO did, that it's going to save for $300 billion over the next 10 years, because Americans will drop their coverage and they won't take advantage of any of the premium tax credits, subsidies, or benefits that are available. Now, I will tell you that the CBO does admit that their projections are uncertain, and I will tell you, with regards to the Affordable Care Act, they turned out to be rather inaccurate. And in fact, Standard & Poor's estimates that it will be more in the $3 to $5 million range over the 10-year period. So I would say that I would take the CBO estimates with a grain of salt, so to speak. So what else does getting rid of the individual mandate do? Well, we don't really know exactly how it's going to affect group premium rates. The passage of the act didn't really make a difference with regard to the people that were enrolling in the healthcare marketplaces. But I will say that there has definitely been some talk among the carriers that they were going to do some increases for 2019 because they believe they'll have adverse selection, basically meaning that only people that have healthcare issues will choose to be coverage. And as I mentioned, you may see as an employer, if you're in your group health plan, you may see an increase in people who elect to waive their coverage. Now, remind people though that they have to have coverage for 17 is over now, but for 18, and the reduction of the penalty doesn't start till 19. And just as information, once this bill was passed, some states are considering imposing coverage mandates for the residents. Massachusetts has it, but there are 9 other states already looking at it. California, Connecticut, Hawaii, Minnesota, New Jersey, Rhode Island, Vermont, and Washington are all thinking about adding individual mandates for their states now that there's no longer one on the federal level. But just to let you know, or just to remind you, the law doesn't actually repeal the mandate, it just changes it to 0. So that means there could be different or future legislation action that could change it to some other number. So just keep that in mind. So medical expense deductions. Well, the out-of-pocket medical expense deduction will remain, and it's temporarily raising it to 10% of the adjusted gross income. But the other thing about that is there's no planned phase out. So that means it's likely to stay at the 10%, which will help people with high cost medical conditions that require expensive drugs or medical equipment. But I did want to mention this because it does have an indirect effect on the group healthcare market. The fact that, excuse me, there is a higher deductible. And this, just want to mention prescription drug impact. And you may have heard about this. There was an orphan drug tax credit that was available, and it was aimed at drug manufacturers to encourage them to develop medicines to treat rare conditions that affect fewer than 200,000 people a year. And they got a tax credit of up to 50%. So this tax credit was initially created, and there's over 500 orphan drugs now. And so just to let you know, what they're doing now is cutting that corporate credit in half. So it's only going to be 25. So what this will do is this will save $54 billion over 10 years. But there is some concern that this means that the drug manufacturers will no longer work on orphan drugs. I will also mention that there is, as you know, the Trump administration has made a lot of comments about they're going to work on reducing prescription drug cost. Excuse me. So I think you will see some continued work on this issue. All right, now this is something, and this is going to get kind of technical, but it's something important to know about, is that the bill changed, the tax cut bill, it actually changed the way consumer price index is done for benefit and tax inflationary adjustments, which include the health FSA, the health savings accounts, etc. Now, the new index is called a chained CPI. And the way that that works is I put some basic information on here for you, reminding you about how the CPI, what the CPI actually measures. But the way that it works is the chain CPI takes into effect that people make change and allows for consumer substitution. So for example, if the price of Granny Smith apples increases, people may buy Gala apples instead. So why do you care? That's the question. The reason you care is because it's going to show a slower pace of price gains or inflation than the traditional CPI, which has been used. So what this means is that the limits on things like health FSA, health savings accounts, are going to go up much more slowly. All right, now just to let you know, some of the things that they originally thought about changing, but they're not. Health savings accounts, there's no change to the tax treatment of those. There's no change to the tax treatment of flexible spending, of course, other than the change CPI, which I just mentioned. And there's no changes to dependent care and adoption assistance, although there was originally, but they left all of those in place. They've left the educational assistance alone, and employer provided health care continues to be tax-free, and it was not impacted by the Tax Act. However, I did want to mention a couple of other things that are not directly healthcare, but are very important to employers. Certain fringe benefits were changed under the Tax Act. So there is now an employer tax credit for providing paid family and medical leave. And if that's something that you're interested in hearing about, again, drop a little note when you're giving your review with us and let us know that we are thinking about doing something on that specifically. A couple of other things that were disallowed is as an employer, you can no longer deduct on-premises athletic facilities. So if you have a gym on your premise and most of it is used by your employees and their families, then that is not going to be allowed anymore. And a big one to think about is that employees' moving expenses are no longer able to be deducted by the employer, and they're no longer tax-free for your employees. So this means if you pay, let's say that you would pay $2,000 to an employee for moving expenses. It used to be that was not taxable to the employee, and you were able to get a deduction for that. Well, now it is going to be taxable compensation. So what that means is for all kinds of benefit purposes, for example, pension plans or 401k plans, that's going to be considered compensation unless you go in and make a change to your definition of compensation. So just to let you know, that could be a fairly large impact if you do a lot of, give a lot of moving expenses. So also, one of the big things is it disallowed employer deduction for qualified transportation fringe benefits. So that means if you paid for parking and other things, you're no longer going to be able to deduct it, but it's still excludable from an employee's income. And just to let you know, though, for some reason, they have something against bicycles because the bicycle commuting expenses are no longer excludable from an employee's income. So if you had some kind of bicycle commuting expense, it's now going to be subject to tax. The other thing that is pretty important is that it disallowed the employer deduction for entertainment, which used to be 50%. And there also it disallowed deductions for membership dues, and it also did clarify something which always had been a standard IRS position, is that the employer deduction and employee exclusion for income doesn't apply to cash equivalents, gift cards, meals, lodging, tickets, etc. That all of those are taxable. All right, so now so that was just a very brief and quick update on the Tax Act. So the other thing that happened, as you may remember, back on October 12th, President Trump signed the executive order called Promoting Healthcare Choice and Competition Across the United States. And one of the changes that it discussed was expanded access to association health plans. And it basically required the U.S. Department of Labor, DOL, to consider proposing regulations. And just as a very quick reminder, the association health plans are considered multiple welfare arrangements, or MIWAs, under ERISA and state insurance law. And they can be fully insured or self-insured. So what actually has happened is the current law required that these association health plans had to have some commonalities of interest. And they were also subject to the small group market requirements. Well, on January 4th, the DOL issued new proposed regulations based on the executive order. And this order would allow small business owners, their employees, sole providers, and others to join together to buy insurance in the large group market. So the proposed rules have a new interpretation of employer. So what that means is employers around the country could band together just if they're in the same trade, industry, line of business, or profession, but had no other connection. And also just employers in the same state, region, or area could form a group. So if you were around, say, Macon, Georgia, you could form the Macon, Georgia Small Employer Associated Group Health Plan. And this is very different because it used to be that you had to have a commonality of interest. Well, then you ask, well, why do you care? Well, first of all, it's going to overturn years of advisory opinions from the DOL. And it is likely that there may be some challenge in the federal court. We'll have to see about that. But what it does do is it'll allow associations to cross state lines. And if you can find an insurance company, because the proposed regulations were more driven towards fully insured plans, is that there might be as many as 11 million Americans that could find coverage under this proposed rule. Right now, it's in the 60-day comment period, and there is support from two potential trade groups, the National Restaurant Association and the National Retail Federation. And truthfully, the reason for that is they do often have trouble finding group health insurance, but if they could band together, instead of being rated on the small group market, which has to take into consideration things such as local area and has many restrictions, they would be able to be considered under the large group market, which would give them much better rates. And the other thing is there'll be much more choice, but just to remember, they may also be exempt from the protections that are in the individual group market. And they may not be required to be guaranteed issue or to change the same or to charge the same premiums. They could have different premium rates. And one of the most important things is these policies may not be required to cover essential benefits. So this means that they could be cheaper, which is truthfully what the Retail Association and the Restaurant Association have really been looking for, is some alternative that provides some coverage to their employees that the employees can afford, but doesn't give them the full coverage that you would get in an ACA compliant policy, because the ACA compliant policy has to provide all of the essential benefits. So the other issue, though, to think about is it could increase the risk of insolvency and fraud. And this goes back to association health plans in the past. And insolvency is where, although they have a good faith effort to provide coverage, an association doesn't have enough money to pay the claims. And they become insolvent, and then whoever is in that plan is forced to pay the coverage themselves. And the other is just plain out fraud, where someone says, hey, I'm setting up this association group health plans for the people who live in Macon, and they collect premiums, but they never actually intend to cover or do anything. So, there is a lot of uncertainty about this, because association health plans will then be competing with the fully insured market. And so the fully insured market may have higher premiums and less plan choice because of the competition from association group health plans. But all of this is sort of, excuse me, is kind of an unknown territory at the moment, and we are waiting to find out what comments come back and what the final regs look like. So keep posted, and I will give updates as that comes along. So I just want to mention that the continuing appropriations bill also had a few things in it, and it was passed on the 22nd to continue the government through the 8th. So as you know, they're now in the process of trying to do a second one. So it delayed the Cadillac tax on high-cost health plans until 2022. It previously had been delayed to 2018. And then there is a annual health insurance fee will not apply in 19. And it has been suspended, and it is going to apply in 18, but it will not be applying again until 2020. So that was something good for the health insurance company. And the 2.3, excuse me, % medical device excise tax was suspended for 2018 and 19. So one of the reasons that they make these changes in the continuing appropriations is they don't have to pay for themselves, so to speak. So unlike what was in the Tax Act, where you had to have cuts to offset additional funding, you don't have to do that in a continuing appropriation. So the other thing that was included was $2.85 billion in funding for the Children's Health Insurance Program, or CHIP, and extends its coverage for 6 years. So as you may remember, basically the CHIP was not, in 2017, the CHIP program ran out and had no funding. So the states can now go back and use this for retroactive funding for the CHIP program. So this was actually welcome news to everyone that they did go back and provide that funding. And again, the reason why they put it in this continuing appropriation is it didn't have to have an offsetting reduction. They could just provide $2.85 billion. So just to give you some final thoughts, and then I'll open it up to any questions if anyone has any, is that the ACA is alive, the Affordable Care Act. It isn't going anywhere yet. And employers still have to plan to meet the requirements and to comply with the employer mandate to the extent it's applicable. They're large enough and they're applicable large employer. So tinkering is more likely to be what is going to happen in the future. And just to give you an idea why I think that is, for example, President Trump did not even mention healthcare repeal and replace, or really didn't talk too much about healthcare at all in his State of the Union address. And the Republicans' priorities appear to have shifted away from full repeal and replace, because honestly, they are shying away from it because they were not successful in passing it earlier. And so they don't, it seems that they are shifting away from that. But what you might see is that some of the ACA mandates, I know right now it's just the individual mandate, but you may see others that are not enforced. And there are states such as Iowa and Michigan who are pushing to change the structure of the ACA and to request waivers of the essential benefit requirements. So, for example, so that they can lower the cost. And the reason for that is because sometimes those two states specifically had difficulty even getting even a single insurance company to offer policies on their healthcare exchange. So that is also going on. And based, as you saw with this new association health plan regulation, the executive order, there are going to be other continuing regulations that come out based on that. And then one thing I know that all of you that are in the process of sending out all of your Form 1095 forms right now is the tax reporting. There is, everyone I know would like for that to go away. And there definitely has been some discussion about that because of the fact that after 2018, there will no longer be, individuals will not be required to have coverage. So there's a question of, so why do we have to provide the form if they're no longer required to report it on their taxes? So that's something that keep an eye out. And if that happens, I definitely will be sharing that with you. So that is it for today. I'm now going to open it up to questions. You have the ability to send the questions in your, I believe, in the chat. Liz, please feel free to let me know if that's not correct. So if anyone has a question, they can ask that to me at this time. All right, well, it doesn't look like we have any questions. So in your feedback, please let me know what you think of this short 30-minute or about 30-minute webinar, if you like that format for just quick updates. And if that's something that you enjoy, give us some topics that you would like to hear about, and we'll be happy to do that. And now I'm going to turn it back to you, Liz.
Great, thanks, Laura. And I thank everybody for joining us again today. If you would like a PDF of this presentation, please email sgrcommunications@sgrlaw.com and I will send you a copy. And for more information on other upcoming webinars or events, you can email us or you can visit our website at sgrlaw.com. And that's it. So everybody have a great day. Thanks.